there's two main kinds of fiber. One is soluble fiber that dissolves in water, and there's insoluble fibers that do not dissolve in water. And then there's something else they're calling a third kind of fiber now. It's called resistant starch. And we find this especially in beans. And so beans are great for us, great for diabetics, great for all of us. Now, you want your colon to be happy, right? You want a happy gut that's healthy. We don't want colon cancer or all those kind of things that can happen to the colon. And if you eat the right foods with lots of soluble and insoluble fiber and resistant starch, it feeds your good gut bacteria and encourages the right kind of bacteria in your gut. Now, you've probably heard of probiotics where you're putting the right kind of bacteria in, but we're not going to talk about that tonight. We're going to talk about prebiotics, foods that encourage good bacteria growth. And by the way, you may not have known this. I didn't. It was quite interesting for me to find this out, but most of your stool is actually bacteria. I thought that was very interesting. We never think of it that way, but there's trillions and trillions and trillions of bacteria in the colon and in your stool. And so when you have a bulky stool, most of that is actually bacteria that you have. Okay. Now, when we feed this good bacteria, the kind that we want in our colon, it produces something called butyrate from these fibers that it breaks down, and it gives us a healthy colon lining that helps prevent inflammation and helps prevent colon cancer. And, those are real concerns today. A lot of people have colon problems. So just by feeding that gut bacteria, it gives this produces this substance that's very healthy for us. And also, we talked one night about making smoothies to get more nutrients, but there's a lot of benefits of just chewing your food because we chew imperfectly. No matter how well you chew, you're not going to chew as well as the blender does. Part of that passes on down into the colon, and then those bacteria work on that. So actually, it helps those bacteria when you don't blend, when you leave a little bit of something for them to eat on. And so they did this study, and they took a group of people, they split into two parts, and they had them eat the same food for breakfast and lunch. Now, for breakfast, for example, they might have had oats. It's like a whole oat in the form of muesli. I think I've got a picture here. So like something on the top left. And then they took that same food and blended it and gave it to the second group. For lunch, they might have had something like beans in the whole form on the left, and then they made it into something like hummus that you see in the right picture at the bottom. And so you have a more of a whole form here in a more broken down form. And what happened was that now all of this was whole foods. They're just, one is blended more than the other. And it showed that the whole food that was not broken down with a blender actually doubled their stool size more than the ground grain diet did, or the ground diet. And they gave the bacteria so much more to eat that the bacteria multiplied more. And so even though people were supposed to chew their food well, when they inspected the stool that came out, they found sometimes intact, like whole pieces of seeds or grains. And so, but then they looked at it under the microscope, and what they found was that they weren't really intact at all, but the bacteria had been chowing down on these little things that pass through, and that fed the bacteria. So I'm not encouraging you not to chew your food. Chew as well as you can, but some of that is still going to go down and feed those bacteria in our colon. And so some smoothies are fine, but you don't want to blend all your food. You want to chew also, okay? And if you eat the right foods, you'll get those good bacteria. There are bad bacteria that can multiply. Now, I'll just tell you right off the bat, the good bacteria are promoted by what kind of foods do you think? The plant-based foods, okay? The bad bacteria that will produce substances that can actually lead to more colon cancer and inflammation will proliferate with an animal food-based diet. And this can change very quickly. Let's say you've been eating, a meat-based diet. Just within a few days, if you go on a whole food, plant-based diet, that whole bacteria population can change very quickly, just within a few days, or back the other way. Whatever you feed is what grows, and so you want to feed the right things, and you'll get the right bacteria. Now, we'll go to the insoluble fiber first and just take a quick look at this. And the insoluble fiber has a very important function in the body. It captures water like a sponge, and so it makes the stool spongy. It holds water. If you don't have this insoluble fiber in your food that goes on down, then the water will just leave that, and the stool will become dry, and you will become constipated, right? Okay, so it's very important. This is very important that you drink enough water and have the insoluble fiber. And the residues, the fecal material, moves down through the colon by a process called peristalsis. And so the colon squeezes on that. If it's nice and spongy and fluffy and big, then it squeezes it on down easily. And you could think of it kind of like squeezing a tube of toothpaste that just comes right on out like it should. But without that fiber in there, you're going to get some rocks, okay? It dries up. Now, with this cycle, what happens is people get constipated. And we've counseled with people all over the world, and I find constipation is a major problem everywhere, no matter where you are. And so people often take a laxative, and so that relieves the constipation, but they didn't remove the cause of the constipation. They still don't have enough fiber in their diet. They're probably not drinking enough water, because even if you got the fiber, if you don't drink enough water, it's going to get dry. And they don't move enough. We're becoming a very sedentary world. And so you've got to move also. And then if you don't change that, if you don't add the fiber and the water and the movement, then the constipation will come back. And what do they do again? They take another laxative. And this is just a cycle people go through. So natural laxatives are movement. You want that exercise, plenty of water, lots of whole plant foods. Everything you eat should be a whole plant food, actually. You don't need refined products. Whole plant foods, whole grains have a lot of this insoluble fiber. And the regular meal times also helps this too. We're in a society today where we just kind of graze a little here and there, but we need regular meal times, and that will also help you stay regular. Now, if you're constipated a lot, you can develop something called diverticular disease. And a lot of people have this because as the colon wall tries to press in with this peristalsis to move the fecal mass downward, it can't press, and it pushes out these little pouches on the side of the colon called diverticuli. And then you develop diverticular disease as you get these little diverticuli. And here you can see, here's one pouching out here in these drawings. Here's a real picture, and those are quite large here coming off on the side. And this is a very common intestinal disorder which can be prevented by preventing constipation with a whole foods diet and lots of water. And they have done studies, lots of studies on diverticulosis, and they found that in societies where people eat a whole food plant-based diet, that they really don't get this disease. And so they did a study among Africans and in Africa and African Americans. And they found that more than 50% of African Americans in their age 50s age group were found to have diverticulosis. But then they went to Africa and they looked at autopsies that were done in Uganda, and there was only, in this particular study, only 2 out of 4,000 Africans that were found to have diverticulosis. And then they looked at Johannesburg, South Africa, and there were no cases of diverticulosis found in 2,000 autopsies. And so this is the same genetic population. We can see it's not a genetic problem, but it's a lifestyle problem. When people come to the United States, they get on the American lifestyle, the American diet, and then they start to get these problems. This is across the board with many different diseases this happens. And varicose veins also. Now, your veins are designed with thin walls because there's no pressure like there is in the arteries, and they have these little valves that keep blood from going backwards. And so if you're constipated, this goes back to constipation again, if you're constipated and you strain when you're having a bowel movement, it cuts off the blood flow going upward. So the blood's coming from the legs, and then your abdominal area, you tense up, and it presses in on these veins and cuts off the blood flow. And so it may not last long, but over time, see, that blood can't go anywhere and you have more blood coming in, so it starts to stretch those veins out. And then eventually it can get bad enough that, you get this back where the blood can go backwards and they get worse and worse. Hemorrhoids is a similar problem in the rectum and anus. And you can get hemorrhoids inside or outside. They're quite uncomfortable for people. This is from straining. Maybe other causes too with the varicose veins in the legs. There seems to be a pretty strong genetic inheritance there also with the varicose veins in the legs. Okay, and then hiatus hernia. It's a similar problem. When you strain, it puts pressure. And so this can actually, if you have a little bit of a loose opening in your diaphragm, it can push part of the stomach back up into the chest cavity, and that's a hiatus or hiatal hernia. Appendicitis also can be caused by constipation because fecal material moves in and out of the appendix with peristalsis, just like it does through the rest of the system. And you get some hard fecal material that blocks that so it can't get out. It sits there. There's a lot of bacteria in there, and it starts to get inflamed. And of course, if your appendix ruptures, all of this bacteria can go into your abdominal cavity, and you can die very quickly. You want to get to the doctor if that happens. Okay, now let's look at soluble fiber. This is found in most fruits and vegetables, and legumes, whole grains, nuts, and seeds. Actually, there's probably a mix of soluble and insoluble fiber in most all foods, but there'll be predominantly one or the other. And with the soluble fiber, it becomes jelly-like. If you've ever bought jelly at the store, pectin is a soluble fiber. It'll have pectin in it, and that's what makes it gel. And you can make jelly yourself with fruit juice or something by adding pectin. And it also slows the rate at which food leaves your stomach, so that helps you have that full feeling for a longer period of time. Slows the absorption of sugar into the bloodstream that's released from your food, and it helps stabilize the blood sugar curve. So that means instead of getting these sharp spikes of your sugar in your bloodstream going up and then maybe going too low, it's more of an even release into the bloodstream. And that keeps you from getting hypoglycemic, and it just helps you be able to make it till the next meal time. And then also, soluble fiber binds bile acids in the small intestine. Bile is made in the liver, is stored in the gallbladder, and then it's shot into the small intestine to break down fats that you eat. And so this bile has a lot of cholesterol in it. And so the bile will be reabsorbed if you don't have good soluble fiber in your diet, but if you have that fiber, it will combine with these bile acids and help carry them out of the body. You want to get rid of that. You don't want to reabsorb the bile. It causes problems when you do that. Your cholesterol levels will go up if you're reabsorbing your bile. So this helps lower cholesterol levels. Now, if you have lower cholesterol levels, that helps prevent heart disease, right? So actually, fiber can help prevent heart disease by lowering those cholesterol levels. And so you can see here, this is a clean artery, some cholesterol buildup in this artery, and then a lot of cholesterol buildup. You're getting ready for a heart attack at this point. And so just by eating some fiber, you can help prevent this. And, I just wanted to mention that they've done studies with these fiber supplements, and as opposed to a whole food plant-based diet. And the supplements really don't work to prevent all of these things like the whole food plant-based diet does. They're not sure that it's all just fiber that does this, because there's a lot of things connected with fiber. Remember, we have that orchestra of nutrients, and so all of these work together to bring about these good results. It may not be just the fiber. So taking a supplement, well, that can move your bowels, but it's not the best solution to the problem. You need whole plant foods like God created them. And then gallbladder disease, if your cholesterol levels are high, your body will put a lot of that, trying to get rid of it, into your bowel. And then that sits in the gallbladder, and it comes out and forms stones. And they've shown about 80 to 90% of gallstone cases, the gallstones are made out of cholesterol, from high cholesterol levels. And so you can help save your gallbladder and prevent gallbladder disease by eating whole plant foods and keeping that cholesterol level lower. How about breast cancer? Well, they're finding these reabsorbed bile acids collected in tumors in the breast. And so now they're making the association between breast cancer and low fiber and reabsorbed bile acids. So it helps prevent breast cancer also by eating these high fiber foods. Fiber can also bind up toxic elements like lead and mercury, which we may not on purpose eat, of course, but they are in some of the foods that we eat. Our environment is very polluted, and so we'll take these things in, but fiber can help bind that and get rid of it. And by the way, it just did mention that even without the fiber, that plant foods, independent of fiber, can help bind these bile acids also. Okay, with colon cancer, you've got these bacteria that feed on the good fiber, and that reduces your risk of colon cancer. And also, the high fiber moves that stool out, and so it reduces contact time. So if you have some carcinogens in your diet, that gets rid of it faster if you have the high fiber diet, instead of it just sitting there as it would if you were constipated. So that also lowers your colon cancer risk. And obesity. They did a study in a double-blinded randomized trial of overweight and obese men and women. Almost 90% of the real oatmeal tested subjects had reduced body weight. They took some subjects and gave them real oatmeal, and some subjects thought they were getting oatmeal, but they didn't. I don't know what they got. I can't remember. But the ones that got the real oatmeal actually lost weight, and compared to this control group. And they lost a little weight on their waist. Their cholesterol dropped, and they had an improvement in liver function also. And one of the things that helps with the weight, with the soluble fiber, is it forms that gel. Remember, when you combine it with water, it forms a gel. It forms that in the stomach. It makes it feel full and delays that stomach emptying. So that's one of the benefits of it. And then non-alcohol fatty liver disease. This is the main cause of liver disease today, is from overeating. It's from being overweight and obesity. It's very damaging to the liver. It can even lead to cirrhosis of the liver, which has been an alcohol-caused disease. But obesity now, they found, can cause cirrhosis. And they found out that whole grains, as opposed to refined grains, actually decrease your risk of that. The whole grains have a protective effect on the liver to help protect against the non-alcohol fatty liver disease. And I just wanted to look quickly at a rice kernel here. This would be pretty much the same for wheat or other grains. But what you're looking at, this is a husk out here, or a hull that has to be taken off. And then inside, this little grain pops out, and you have a covering here. That's the bran. That's where your fiber is, on that outer part, right out here. It's a little thin layer. Your bran is there, and your fiber, and most of your phytochemicals are out there. And then you have the germ that has some vitamins and oils and minerals and so forth. And what they do is when they make white rice or white, polished wheat to make white bread, they polish off this outer layer of bran and they take off this germ. So all you got left is this inside, which is mainly starch and some protein. All your nutrients are gone, your fiber's gone. So if you really want to get all the benefit from your grains, you've got to have whole grains. You need 100% whole grain bread. And this is just showing a picture here, whole wheat bread as opposed to white, brown rice as opposed to white rice. That's what you're looking for. That's what you want. Okay, so we get exceptional fiber in beans. Those are the best. They have more than twice as much fiber as any other food. And berries, all kinds of berries. These are very high in antioxidants also. And then excellent fiber in the root crops and in whole grains. Very good fiber in all the fruits and vegetables. Poor fiber if you peel your, like apples or whatever. A lot of the fiber, most of the fiber in an apple is actually in the peeling, so you want to keep that peeling if you can. And poor fiber when you juice. Even if you juice at home, you'll get a little bit, but it's not going to be very much. None in the animal products and oils and sugars and dairy products, that kind of thing. So if you want fiber, you've got to eat whole food, plant-based. And unfortunately, most of the world is moving toward the Western diet. And I like this picture because it really portrays that. We've been in a lot of different countries, and the diet is changing. And so people that used to eat their traditional plant foods are now going to McDonald's and buying colas and all this. You can see that everywhere. And their health is starting to show that also. And so I'm just going to end with this Bible verse, Isaiah 55:2. Wherefore do you spend money for that which is not bread, and your labor for that which satisfies not? And this has, in the Bible, a spiritual application that we're looking in many places for something that satisfies us, but we can't find it there. It's very applicable today with our food also, that we're spending on food that is non-food, that doesn't nourish our body. We need good, healthy food physically and spiritually, right? Thank you.
That's where we're going to start. My wife works as a surgery tech. She hands the doctors the instruments. As at Wildwood Hospital. I worked as a human resources director, paperwork, shuffling papers. One day the surgeon asked me if I would assist him in surgery. I said, well, certainly. You need my help? And so it's my only time in surgery. I washed up and got the gown on and everything. I went in there. And what he wanted me to do, there was a man 300 pounds. He wanted me to hold him in a certain angle while he did his work. And it was a hemorrhoid operation. What causes hemorrhoids? Straining the fiber. Yeah, that's it. So I sit there, had a bird's eye view. And then the surgeon, Dr. Nelson, he asked for a certain instrument. And I don't know what he called it, but the person that handed it to him, it looked like a pair of tweezers. And then he called for something else, looked like a pair of scissors. And I thought, what's he going to do with that? And then I soon got to see. And when he did the first one, he had 6. And when he cut the first one, I said, I got to eat more granola, right? The second one, I got to go to whole grain pasta. The third one, that's an experience. Dear friends, we save ourselves a whole lot of heartache and other kind of aches just by following God's health plan. Ain't God good? I'll pray, I'll start. Father in heaven, bless us this evening. Please help this poor sinner. I ask it in Jesus' name. Amen. 3 John 2. Now, knowledge is power, but you got to know something before you can have power, right? So 3 John 2, the physical factors of the mind change, right? Romans 12, verse 2, be not conformed to this world, but be ye what? Transformed. Now, transformation of the mind and how it links up to the physical factors. Now, before I begin, December 10, 1871, this is I was again shown the health reform as one branch of the great work, which is to fit a people for the coming of the Lord. Now, if you were the devil, wouldn't you want to frustrate the health message? Wouldn't you want to put a halt to the health message? Yes, because why? Then the Lord can't come. The health message is to prepare a people for the second coming. Isn't that great? It is as closely connected to the third angel's message as the hand is with the body. So 1 in 8 women are diagnosed and die of breast cancer. Every 3 minutes, a woman is diagnosed with breast cancer. Now, is fiber a factor in a risk factor for breast cancer? Well, sure. Now, if you were a woman, what you want to do is frustrate the devil's plan to give you breast cancer. In order to prevent breast cancer, you have to know what causes it. One factor is fiber, other factors too. So knowledge, you got to know, and then you have to take action, and that equals dynamite. Right? So far, so simple. Now, something called metabolic syndrome. Metabolic syndrome is not a disease, it is a class of risk factors. I'll show you a picture, but 1/3 of Americans have it. If you're typical, then probably we had 300 in the church, 100 people would have metabolic syndrome. What it is, these numbers. You got your blood sugar, you got the cholesterol, which includes HDL and the risk factors. You have a BMI, body mass index. You have these numbers. Numbers do not lie. If you have 3 of these 5 factors, they say you have metabolic syndrome. So if your blood pressure's up, you're diabetic, you're overweight, then you're just a candidate to die early, right? Doesn't that make sense? The numbers can reveal something about mortality rates. They call it metabolic syndrome. They group these numbers, and I want to take one of those numbers tonight and look at it and connect it to the transformation of the mind. This, of course, we all know before the flood, the folks lived a long time. After the flood, lifespans, mortality. Why? Change? That's just dietary change, right? Dietary change. They began to eat something after the flood they didn't eat before. Now, why did they do that? Because God gave them permission. Why did He give them permission to eat meat? Yes, yes, and yes. But one more reason. After the flood, God permitted that long-lived race to eat animal foods to knock 800 years off their life. Because the thoughts of men were wicked how often? Continually. So if you want to knock 800 years off a man's life, now help me to, now you know I love you, right? You love me, I love you, right? This is the household of faith. But what binds us together is T-R-U-T-H, truth, right? So if you want to knock 800 years off a man's life, do you give him a chicken sandwich? Yes, yeah, sure, that's it. So soon after the flood, the race began to rapidly decrease in size and in length of years. And this is one reason God gave man meat to eat, to shorten down that sinful life by 800 years. Did it work? Yes. Now, burden of heart disease in the U.S., we know number 1 cause of death is heart disease. Knowledge, power, right? Action between the knowledge and the power. Knowledge plus action equals power. So number 1 cause of death, vascular disease, heart and blood vessel disease, strokes and heart attacks in the United States. It's been that way for decades. Number 1 cause of death worldwide is the same, right? How to lower blood pressure. Now blow it up. See that? Stop the silent killer. Why do they call hypertension the silent killer? Because often you fall over dead of a heart attack before you know you have it. It's a silent killer. Because often no symptoms associated with hypertension. Some people in here may have hypertension, you don't know it because often there are no symptoms, right? Now I want to just ask a couple of questions. When you go to the shopping mall, anything over 140 over 90 is hypertensive. You go to the shopping mall, they take your blood pressure, it's a health expo. They tell you it's 220 over 170. What do they tell you to do? How soon? Yeah, go to the emergency room. When you get there, what does the doctor typically do? Gives you a pill, calcium blocker, diuretic, something. The problem with that, the doctor did not address the cause. And what's the cause of hypertension? Yeah, diet, not enough exercise, too much stress, too much sodium, not enough sleep. There's lots of different factors. And it's very simple. Now, how can something like that affect your brain and the transformation of your mind. The first night, we looked at axons and dendrites, brain chemistry. There is a picture of the axon coated with something called the myelin sheath. That is a collection of Schwann cells. What it does, it insulates the axon and what do you call it? And it's, no, there's a word for it. What does it do? Expedites the transmission down the axon. Now, if you have hypertension, the myelin sheath on your axons in your brain begin to very slowly disintegrate if you have hypertension. You go to the doctor, he gives you a pill. Can that bring the numbers down? Yes. What does it do as far as deterioration of the myelin sheath? Nothing. Dear friends, you can't short circuit transgression of the health laws with a pill. You still got the problem. And that can affect how you think. So now the question is, I go to the doctor, I got this pain in my shoulder, and maybe some bursitis. And the doctor says, well, let me give you a shot of steroids or cortisone. What should I say? I'll say, why? And what will the doctor say? Will it take away the pain? Will it fix the problem? No, it won't fix the problem. This is the science of pain management today. I'm not against pain management, but I'm all for addressing the problem. So you have on the left, yes, your lefts, we're looking at the same thing. On the left, you have a nice, artery. On the right, you don't want that kind, right? So you see these pictures, and on the drawing it says plaque. Well, the question is, what is danger men thinking? Now we ask questions. What is plaque? What are the constituents of plaque? Yeah, you say fibrin and calcium, but what are the main constituents of plaque? Fat, and chiefly saturated fat and cholesterol. So this is the death of an artery. And by the way, you can still live when it's like that. But when it gets like that, you're not going to live any longer. The question is, what fills up those arteries? So I want to show you something kind of graphic here in a second. It's open heart surgery. It's a video clip. But a picture is worth 1,000 words. Now on the bottom, that picture, that's called a omelet. It's an omelet. When I was in the Army, I was in the U.S. Army 1975 to 78. And when you would go to breakfast in the chow hall, the first station you went to is the omelets. And he would say, the cook would say, what kind of omelet do you want? I said, Western omelet. Took 4 pats of butter, took 3 eggs, and then on the Western omelet, you got peppers, and you got onions, and you got cheese, and he made this omelet and rolled it up and put it on my plate. Now, when they did autopsies for Vietnam veterans and Korean War veterans, and these people, killed in action, Vietnam and Korea, and they were 20, 21, 22, did they have atherosclerosis? These hardening of the arteries, this buildup of plaque in the arteries. Did they have it? Yes. Why? Eating that. I read. Atherosclerosis. Hardening of the arteries is a disorder in which arteries, blood vessels that carry oxygenated blood from the heart to the body, become narrowed when fat is deposited on the inside walls of the arteries. I just took that out of a Nursing 101 textbook. And that is, we're asking why. Well, that's a factor, the diet. Is circulation good? Yes. How many brain cells do you have? More than the sand in the sea or the stars in the sky. Is circulation essential? Yes. If you have an ischemic stroke, circulation's pinched off to the brain. Can that cause a problem with the way you think? If you have an ischemic stroke, if you have a heart attack, the blood flow is blocked to the heart, can that kill you? Even if it's silent, you're still dead, right? Now, thinking and physical factors. Neil Nedley, probably our most famous physician, lifestyle physician in our church, did a study. Before I show you what he found, I'll ask you. People that have debilitating depression, blood flow in their brain, circulation in their brain, they found it to be going up or going down. Now we read. Proof positive. Sophisticated brain scans, PET scans, reveal that depressed patients may have a 60% reduction in frontal lobe blood flow. In working with depressed people, then they reason if we could raise circulation in the frontal lobe, it might help with the depression. So you have on the right the blue and on the left the red. What makes the red red? Oxygen. Now you notice the transfer of oxygen that takes place in that little network called the capillary. And this is a picture of a capillary, and it narrows down, precapillary sphincter, smaller and smaller. But it's in the capillary where the oxygen carried by the hemoglobin in the red blood cell is dumped off to the cells. It's in the capillary. So there's a picture of a red blood cell. In the red blood cell, a constituent part, the hemoglobin transports the oxygen. How many do we have? 30 trillion. That's a whole lot of red blood cells. How many fit on the head of a pin? 64,000. I said that once, and a lady said, "Did you count them?" I said, "No, I read it in a book. I didn't count them." But that picture is very accurate. Dear friends, now, 4 or 5 important points. We're to the first one. That red blood cell carrying oxygen to your brain so you can think, that's where it's transferred in the capillary. The red blood cells, to go through the capillaries, have to do what? Line up and go through one by single file, one by one. And they have to fold themselves slightly to even get through the capillaries. Now you got 30 trillion red blood cells. You must have a whole lot of capillaries. How big are the capillaries? Microcirculation. What does it take to clog up the capillaries, to block up the arteries, to diminish the blood flow in the brain? It doesn't take much. Can your diet have an influence on how you think? And if you're trying to transform your mind, first things first, you need a good diet. Wouldn't you agree? Now, this is a really gross thing I'm about to show you. There's a picture of blood in a test tube. When I click it, this is a doctor named Alan Clapper. He's narrating. It's about, a minute long, minute and 20 seconds long. Michael Clapper, doctor, is narrating this little clip. It's an experience he had. He was drawing blood. He's an anesthesiologist. He drew blood, and what he saw in the test tube, he asked some questions, and then it's a picture of surgery the next day. And that's not what the blood should look like in a test tube.
I first woke up, so to speak, when I was working on the anesthesia service, learning how to put people to sleep. And I was seeing my patients for the next day's surgery, for coronary artery bypass surgery, in order to bypass clogged arteries in their heart. Because it was late at night, I drew the man's blood test, and when I took the blood to the laboratory and had it processed, I couldn't believe my eyes. Now, normally, this liquid layer floating on top of the blood clot is quite transparent. It's a yellow, but quite clear. You can see right through it. The blood in this patient's tube, however, was anything but clear. The serum floating on his clot was thick and greasy white. It looked like glue. In fact, it stuck to the sides of the blood tube when I shook the tube. I went back to the patient. I said, "Mr. Phillips, did you eat before you came to the hospital tonight?" He said, "Yes." I said, "What did you have?" He said, "I had a cheeseburger and a milkshake." And when he said that, I realized that what I was looking at in his tube was all the fat in the beef burger, all the butter fat in the cheese, and the butter fat in the ice cream and in the milkshake. And all this fat had oozed out into his blood and actually turned his blood fatty. The next morning, we took Mr. Phillips to the operating room, and I put him to sleep, and the surgeon opened up his chest. And from these arteries, he began pulling out yellow, greasy deposits of fatty material called atherosclerosis.
This is a beautiful example of what atherosclerosis looks like. There it is. And I'm going to just gently tug on this now.
I love it.
It's a little hard to pull. Got the coupon. If you could give it a little pull too. We'll see if we can get this thing out.
We are just holding our breath so that you will finish the case.
There it is. America's #1 killer right there before your eyes.
That is a chicken sandwich. Do you think that affects how you think? Next question. When you have blockage in your coronary heart arteries, does that mean you also have blockage in your cerebral arteries? Yes. It just kills you here before it may kill you there. You have it in one place, you have it everywhere. The great danger, post-flood, 800 years off the lifespan, and that's why. Atherosclerosis. Isn't that gross? Now, some of my work is with Christians, some of my work is not. Typically, many people in the church say, that doesn't apply to me because I don't smoke. By the way, that's a staged photo, because if you were to really smoke that many cigarettes, you'd be dead after a few puffs. There's benzopyrene to kill 10 men in those cigarettes, right? It's a staged photo. But and also 7 seconds after you take that first puff, every blood vessel in your body constricts. And that's not a hamburger, that's nicotine. Nicotine has a twin sister in the alkaloid family of poisons called caffeine. Tea, green tea, chocolate, coffee, Cokes, that's caffeine. 7 seconds, it constricts every blood vessel in your body. And that's the twin sister of nicotine. Now, the cholesterol bomb. What's the highest cholesterol food? The plaque in the arteries, largely the constituents, plaque and saturated fat. The cholesterol is one of the metabolic risk factors in metabolic syndrome. So, what's the highest cholesterol food on the planet? That one. Yeah, that big old fat Hardee's double thick burger and an egg have just about the same amount of cholesterol. The egg is the highest cholesterol on the planet. It's the eggs. Are eggs good? Yeah, they're good, right? How many did I eat when I was in the Army? 3,000. You know, the eggs are good, aren't they? Come on, eggs are good. They taste good, I mean. Isn't God good? And then diet and exercise. And this kind of ties it all up together. We talked about these neurotransmitters. If you have a pathway going from your brain to your foot, the two classes of neurotransmitters at work, probably acetylcholine and gamma-amine butyric acid. One says yes, one says no. One says stop, one says go. But the way we feel, our attitude, our mood, they're called mood pathways. They're not in your legs or your pancreas or your spleen. Where are mood pathways, the way I feel? Where are they at? Take a guess. In your brain. Now, probably the most active neurotransmitter at work in the mood pathways in your brain is that one, serotonin. Right? It's a very, it's a catchphrase word today, serotonin levels. You get your serotonin up. Well, it's true. You need to get serotonin up. Because serotonin levels go down when people have depression. Circulation goes down, serotonin goes down. Need to raise the serotonin levels. How can you do it? High levels of serotonin are associated with elevated mood, while low levels are associated with depression. Though many neurotransmitters work in harmony to influence mood, chiefly after serotonin, dopamine and norepinephrine, serotonin is one of the most important. Its levels are influenced by external factors such as, give me one word to sum up those last three words. Give me one word to sum it up though. Lifestyle. Yeah, I agree. Actually, yeah. Lifestyle. Your lifestyle. Now, I'm not going to read the studies. Well, one short one just to, what is it? What time is it? 8:43, okay. My wife took my watch. The effects of exercise on serotonin levels. Here's from Harvard. Harvard says exercise and depression. And you know what they're saying in all this research for the last 10 years? If you want to raise your serotonin levels, what do? Exercise. Now, you can read it. I'll tell you what it says. They took an SSRI drug. This class of drugs, Zoloft, Xanax, Prozac, Wellbutrin, SSRI. It's the dynamic, it's how it works. SSRI, selective serotonin reuptake inhibitor. So Zoloft was an SSRI drug that they took 3 groups of depressed people. One got the Zoloft, one got exercise, one got both. And this is the study. At the 16-week mark, depression had eased. In which group? All three. All three. 60 to 70% of the people in all 3 groups could no longer be classed as having major depression. In fact, group scores on 2 rating scales of depression were essentially the same. This suggests if you're looking for an alternative to antidepressants, you might want to try what? Exercise. Now, what are the side effects for exercise? No, enhanced mood, lose weight, metabolic rate at which you burn calories increase 24 hours a day. It's just win, 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 win. Well, what's the problem with SSRI drugs? Well, that's one problem. The FDA makes it put a warning label in all the drugs now that says this may make you take your life. Suicidal tendencies for taking SSRI drugs, and that's the FDA. And the FDA didn't want to do that. There is pressure from the pharmaceutical industry, but the evidence was so overwhelming, that's the law now. Anybody that you know that is on an antidepressant, they have that warning label in that SSRI drug. Now, next question. And then these are not rhetorical, you answer. Let's say that I had this suicidal thought. Man, I'm depressed. I go to the doctor. Now, in New York, it costs a whole lot. Before a doctor can prescribe, he must diagnose. Before he diagnoses, he must evaluate. I just lost the mind. He must evaluate. Can you hear me? Yeah, he must evaluate. Now, so he does an evaluation. Does this one work? Yeah, it works. So he evaluates. Now, an evaluation, $400. Pay up, $400. Now I make my diagnosis, bipolar tendencies toward debilitating depression, and now I give a prescription. So Prozac, I looked. Prozac, out of your pocket pay, no insurance, 90 days, $390. That's $800. You spend $800, you go home, you got your Prozac. You open it up and you read the warning label. This may make me kill myself. Well, wait a minute, you call the doctor. And you say, I came to you because I was suicidal. You gave me a pill that might make me kill myself. Now, I'm the doctor. This is what I say. You say to me, how could you do that? And I say to you, I have no other option. Now, what do you say? I have no other option. What do you say? Now, let's rewind the tape. You come to me, $400 please, evaluation. Now I diagnose and I write your prescription. You're $400 in my pocket. You go home, you read your prescription. It says take a walk. How do you feel?
Upset.
Thank you. Upset, cheated, ripped off. Yeah, we don't want the plan. We feel upset when we have the plan. We don't want it. You robbed me when you gave me that plan. But give me a pill and let me go on doing just what I do. It requires no change. And that's the problem. We are a pill-happy society. Thinking we can get happiness from a pill does not happen. Now, this is infrared thermography. What this is, when you take a photo using this kind of technique, the places with minimal circulation appear white and blue, but increased metabolic activity and circulation appear orange and red. This is why when you go outside in the winter, New York City in the wintertime, what's the first thing? You don't have your coat and your gloves. What's the first thing that gets cold and hurts? Yeah, your hands and your ears and maybe your nose, because those are areas where you don't have a lot of the extremities circulation. So in that kind of picture, my fingers would be what color? Blue. And but my trunk would be what color? Well, here's a picture of a head. Now, this has nothing to do with mental health. These are students taking a test. They did a study and had the students, one group sat and did nothing. The other group took a walk before they took the test. Which group took the walk? It's obvious. Of course. Which group did better on the test? Absolutely. Does exercise do something to stimulate circulation in your brain? Yes. It's a win-win. You mean I just need to exercise? Yes. And the devil says what? Thou shalt not, starts with an E, exercise. It's really nice. In the sunshine, exercise. It's a win-win situation. So these are the foods that can increase serotonin. Good diet, good exercise, good fiber, good THINKING. So our physical factor is important when it comes to having a right mind. Yeah, it's very simple. Now, Ministry of Healing, the 3-day diet. This is right from the book that we use to structure our health program. Grains, fruits, nuts, and vegetables constitute the diet chosen for us by our Creator. Let me just say one thing. These men today, anybody ever heard of Dean Ornish? Or Caldwell Esselstyn? Or T. Colin Campbell? Or Michael Clapper? Or Michael Greger? You've heard of some of these guys, right? The problem with them, well, wait, stop for a moment. Let me back up to presidents. Pretend like you didn't hear that. Let me name some names. George Bush, Obama, Trump, Teddy Roosevelt. I'm naming what? Presidents. Now, I'm naming what? Dean Ornish, Michael Clapper, T. Colin Campbell, Carl Esselstyn, Cliff. I'm naming lifestyle doctors. Now, here's the problem with the lifestyle doctors. They have the lifestyle, but they have no Savior. So when we go to the world to get our health message, they got the message minus the Savior. Thank you, the real healer. So it's like can I call it a counterfeit health message? Oh, yes. Because they got the whole package, but left God out. It's a counterfeit health package. It's a counterfeit. Devil deals in counterfeits. Grains, fruits, nuts, vegetables constitute the diet chosen for us by our Creator. These foods, prepared in as simple and natural a manner as possible, are the most healthful and nourishing. Now here it comes. They impart a strength, a power of endurance, and what? A vigor of intellect. Now we have a health evangelism, 1-year health evangelism school. So we have young men coming to our school. And they say, I want to understand the Bible. And I say what? That's it. Food. Huh? I want to understand Daniel 9:24. 70 weeks are determined upon thy people. I want to understand that food. Yeah, food. I want to be 10 times wiser like Daniel. I say what? The food. You eat like Daniel. It is a fact. The brain works best when you follow the best diet. It really does. So I say transformation Tuesday night, what's that? Tuesday, Sunday night, I just suggested be careful what you put into your mind. So that's one factor, what you put into your mind. Another factor is what you put into your mouth. Diet and exercise. 3 John 2, those are the two packages, right? The spirit and the physical. Oh, I didn't read it. The vigor of intellect that are not afforded by a more complex and stimulating diet. And it's really a pretty simple presentation. That when you get on God's plan, it helps our minds to function. I don't know about you, I need all the help I can get. I mean, I've ruined my mind for so many years, doing so many things that were self-destructive. There is a way that seemeth right to Luke Keith, but the end thereof, Proverbs 14:12, is the way of what? Death, destruction, divorce, disease, disability. And the Lord gave me a message to try to help me. Now, you got any questions? Darlene, come up. We're going to take a few questions. And that's it. So fiber's good. Help you think right. Yes, ma'am. Mm-hmm.
What you said about exercise, I actually have an example. You don't have to go through the process of paying for the doctor.
Right.
So they recommend antidepressant and really easy. I remember my father babysitting next door. He was reading and he was on one of those really.
Yeah.
And he went into it for one summer.
Yeah.
All he needed to do was run around. But he was like,
Yeah. Yeah. ADHD, where they give Ritalin. What's Ritalin? Low-grade speed. And what does he need to do? Just run around.
one summer he never did it again.
Yeah. That's a exercise at work. I mean, there are other factors too. But sure, these things work. By the way, I worked 15, 20 years, mental health issues, bipolar, schizophrenia, paranoia, all sorts of things. But debilitating depression, anxiety, stress, eating disorders. What's the plan? Good diet, exercise. Let me just say one thing. A lady called me one time, and she said, "Do you have a plan for reversing diabetes?" I said, "Well, sure. What does it include?" Good diet, exercise. I told her. She said, "Do you have a plan for hypertension?" I said, "Yes, ma'am." "What does it include?" "Do you have a plan for osteoporosis?" "Yes, ma'am." "What does it include?" "Do you have a plan for arthritis?" "Yes, ma'am." She said, "Same plan. It's the same plan." I said, "Yes, ma'am. One size fits all." Because it does. ADHD, bipolar, wife beater. This is it. It's the plan. But don't leave the Savior out of the picture. Yes, sir. Well, schizophrenia and bipolar. Yeah, well, often clusters, right? These clusters of somebody with an eating disorder often has depression, right? Somebody's throwing their guts up 3 times a day to hydrochloric acid, eating up their esophagus and giving it scar tissue. Is that depressing? Yeah. Now, I ask you, when you go into the field of mental health, can you still use the cause and effect principle? If you have paranoid schizophrenia, is there a cause? Oh, yeah. And unless you address the cause, you'll never fix the problem. The latest high-tech means of addressing that kind of problem today is a drug called Haldol. Every 28 days, 1 shot. So I'd like to spend an hour, I don't know when it will be, on mental health issues and God's plan for transforming the mind. By the way, 457 classifications of mental health problems in the great textbook. Now let me ask you, isn't this in the probably the #1 classification text on mental health issues? Where do you find demonic influence in that book? Nowhere. Do you think the devil still has an influence over people's minds today? Do you think the health message is trying to break us free from that? Yes, so the fuller answer is coming. I don't know when. I'll try to work that in. Any more questions? Yes, my brother.
Yeah, they do. They release gas. And so if you eat beans, you're going to get gas. People that have gas from eating beans live longer. So, a certain amount of gas is normal. Yeah, and so it's bacteria working on, things in all these residues in the colon that causes gas. Yeah.
So the person that had the colon they have pockets in their colon.
Diverticulosis? Yeah, with the little pockets, yeah.
They can't eat certain foods because
You know, what they used to say is that you shouldn't eat anything that had like little seeds or bits of things, like not get chunky peanut butter. But now what they're saying is actually it's not a problem if you're not constipated. The constipation blocks it so it can't get out of those little pockets. And that's what causes the pain and inflammation. I think it was Dr. Michael Clapper, but I don't have anything to go with what I'm saying. But he said that you can renew the lining and get rid of those, but I haven't seen that somewhere else. But his specialty was the gastrointestinal system. So I would like to look that up and see, but you can prevent the flare-ups for sure. Yeah. Okay. Iron pills will constipate you. Why don't you change over to blackstrap molasses? It won't constipate you, has a lot of iron in it. Okay, well, what you need to do first is reverse the diabetes. I'm going to talk about that, I think maybe Friday night. But eat the high iron foods. I mean, you know, and you shouldn't have, yeah. Right. Yeah. Well, we have taken a lot of people at our health center. I just want to touch on the diabetes for a minute. With diabetes, and within some that have been diabetic, type 2 diabetes for years, are off their medications within even just a few days. If you get on a whole food, plant-based diet and exercise, and you don't even, you know, most people chase the numbers. They're trying to control the blood sugar level, but what you want to do is reverse the disease, get at the cause of it and reverse it. And you can get rid of your diabetes. And if you're eating a whole food plant-based diet with lots of leafy greens, things, but eat your cooked greens. Those have a lot of iron in them. The cooked leafy greens, collards and kale, and eat both. Eat some raw, but eat the cooked. Eat raisins and prunes and, you know, just the many different things. I know you're diabetic, but if you'll get on the good plan, you can eat some of those things. You don't have to worry so much about the numbers because the disease will start reversing. With medication or without? Okay, but I'm talking about reversing it and getting off your medication. You won't even need any medication. We've had people come off of insulin within 2 weeks, be totally free of needing even insulin when they're diabetes, if you get on this plan that we're talking about. Yeah. But anyway, maybe we can talk later together. Okay. Any other questions?
Can we use the mic so that those online can benefit from the questions?
Yes, I was reading online where Dr. Grundy, who was trained at Loma Linda, so I heard Loma Linda, I wanted to see what he has to say. He's saying that there is a plant protein, lectin, that is primarily present in the shades plant, like tomato and eggplant. No, I never give much for eggplant, but I love tomatoes. But he said that it tends to punch holes in your gut and cause problems, and you might want to avoid that out of your diet. Do you have any information on that?
I haven't seen that the lectins are a problem. I don't know exactly what he's saying, but these are good whole foods that, you know, that we can eat. There are lectins on beans that can be harmful if you ate raw beans, but as long as you cook those, it destroys the lectins. But yeah, I haven't seen anything to say that would be harmful. It's what? It's online, okay. So I'll take a look and see. That sounds a little not in harmony with the spirit of prophecy as far as I can tell, or with other science.
As I said, it's because you mentioned he was low trained. So that's why.
Yeah, well, honestly, you get a lot of different, that does, just because they're at Loma Linda doesn't mean that everything they say is correct either. So, so.
Yeah. I'd say 2 Timothy 2:15, study to show thyself approved. If you walk up to me, I love you. If you walk up to me and tell me beans are no good, I say, let me see your science. And I mean with a control group, with a placebo control group, scientific. Let me see your evidence. That's all I want, evidence. And somebody said this and somebody said that. A lot of people are saying a lot of things. But what does true science in the Bible say?
I just want to mention, too, when we're talking about science, a lot of food industries today are basically buying science. And so you have to look at who's funding those studies, because the egg industry, the dairy industry, the meat industry, the food industry in general, they're all wanting their money and they don't want that to get cut out. And so probably about 10 years ago, they figured that out and they started buying studies. And so you can set a study up in such a way to show whatever you want to show. You just have to set it up the right way. So you really have to look at who's doing that study and stuff. The science is important, I feel like, because there's so many just crazy ideas out there. We need science. But we also need to filter that, as I said before, through the Bible and spirit of prophecy. And so even if the science looks good and it tells us something's good that we know from the spirit of prophecy is not, then I won't use it. I discard that item too. So it takes a lot of study and discernment today, but basically you're not going to go wrong if you follow the spirit of prophecy. Really, it's all there. Get on a good whole food plant-based diet like God told us to do, like He created for us. And then, we don't have to worry so much about it. But people want science today, so I study the science, and true science supports what God has told us.
So why don't we stand and I'll pray? We're done. Even 1 Timothy 6, verse 20, beware of the oppositions of science, falsely so called. Beware of false science. But God's a true scientist, isn't He? All right, Father in heaven, it's a minefield. It's not just a theological minefield in the last days. It's a minefield as far as health. Heresies and strange doctrines blowing left and right. But help us to be under the wing of the Savior. Give us an unadulterated, purified health message and an understanding of the unadulterated, purified gospel as we seek to greet You with a kind heart and a clear mind at the second coming. I ask this in Jesus' name. Amen.
And this gospel of the kingdom shall be preached in all the world, for a witness unto all nations, and then shall the end come.